citizens of Greenville. I'd like to inform you of a deadly virus spreading rapidly in Charles A. Dean Memorial Hospital. It is named Ebola Reston that is almost certain to cause death of anyone who comes in contact with it. No need to be alarmed, the situation is completely under control. The hospital is under a lockdown, meaning that no one is being let in or out. Patients who are showing symptoms of this virus are being locked in their rooms, and only doctors wearing a Ray Cal spacesuit are allowed to enter the room and treat these patients. All doctors at this facility who begin to show symptoms are immediately checked in as a patient themselves and are put in a private room like everyone else. It is believed that this virus arrived here in Greenville when a new type of bug was introduced to our environment, the blister beetle. The blister beetle was brought in from Africa to help control the amount of bees in our area. In the beginning, the blister beetle seemed to be virtually harmless, but now, studies seem to prove that they are the host of Ebola Reston. Ebola Reston is an extremely contagious virus that spreads quickly between humans and also monkeys. Although there have been no cases of monkeys breaking with Ebola in the United States, there have been outbreaks in Africa of monkeys crashing and bleeding with Ebola. Now you must be wondering, crash and bleed? What does she mean by that? Well, Ebola is a virus that can become deadly just by inhaling a few particles. Symptoms begin with a slight headache within 5 to 10 days after contraction of the virus. As the days go on, the headache will rapidly get worse until it becomes almost unbearable. Soon, you will break with a fever and suffer from severe joint pains. You may also get the chills, suffer from a sore throat, or feel very weak. Over time, you will develop red eyes, a raised rash caused by blood clots under the skin, chest pains, nausea, violent coughing and vomiting, which may be bloody, severe stomach pain and weight loss, and also bleeding from the nose, ears, eyes, and rectum. As this illness progresses, it can cause multiple organ failures, severe bleeding from every orifice in the body, jaundice, delirium, seizures, coma, or shock. Because these beetles haven't fully adapted to our environment, researchers were able to develop a chemical that affects their immune systems without hurting things around it. Once we are sure that the beetles are gone and everyone in the hospital is free of virus, we will begin the decontamination period inside the hospital by removing everyone inside, sealing off all openings and air ducts, and spraying a special chemical that is known for being able to kill off any kind of life. When the decontamination cycle is done, there will be absolutely no life inside the hospital until new life begins to grow and form once again. Although it may be months before the virus has finished its raids throughout the building, the beetles will be dead within days after crop dusters are used to spread the pesticide throughout the town and people will be able to return to their normal lives. I thank you for your patience and cooperation, and I will now answer any questions you may have.